Okay, so we're going to be doing some more what I like to call like functional anatomy lessons. It's more of the conversations that we have on a day-to-day basis of how we explain maybe how certain injuries are occurring, what common range of motion discrepancies or things that might be leading to certain issues. So what we're going to be doing in this particular video is talking about shoulder limitations, right? So for many of us who are doing working out or just even just everyday life, finding that we're restricted in taking our arm up over in this overhead positioning. So we're going to talk about some of the deficits on the back and in between the shoulder here of why that happens so that you can better tackle the limitations and the issues that you might be having. Now, in this particular video, we do not have the fixes for this, right? The application of what needs to be done is secondary to understanding what's going on in the first place, right? So very commonly we'll see three best shoulder stretches for improving your range of motion overhead. Most of those will probably be fine, right? But having that better understanding of where you need to target could be the difference of choosing the right exercise or not. So that's what we're trying to highlight here. We're going to be going anything between shoulders, lower back, hip. We're just going to be really kind of encompassing a lot of different areas. And then what we'll do in conjunction with that, because we want it to be of value to you, is adding, hey, if you were to do this exercise or this stretch, or when you are performing a certain movement, I want you to think about this to enhance your range of motion so that there is then a fix to an application or a fix to the actual educational content about what we're dealing with. So I hope this provides a lot of value for you. If you have other areas that you want to be addressed or talked about, do not hesitate to let us know, because we want to make those for you as well. So we're going to go through some kind of anatomical lessons here for you to visualize kind of what we refer to as like the coach's eyes perspective, or the functional anatomy of what we're trying to accomplish when we're dealing with movement and or trying to improve movement. So it kind of gives you a visual representation of what's going on, but also in the case of pain or mobility limitations and restrictions, because oftentimes what we hear someone else see and or what we Google might not be an accurate representation of what's actually going on. So what we want to highlight here is those that have range of motion issues with bringing their shoulder overhead. So what we're talking about here is this arm, your arm being able to go into an overhead type of position, similar to what we'd see with like an overhead press here, right? So we're going to look at both of these anatomical models here to give us an idea of what we're actually talking about here. So we're not talking about the prime movers in the sense of what actually moves the arm. We are going to be talking about some of the mobility restrictions that usually lead to these deficits. And when we come back to this model here, a couple areas that we want to highlight is when we were talking about overhead range of motion, we should see a 2-to-1 ratio of movement between the upper arm and the shoulder blade to the thoracic cavity, the ribs, or the mid-back. So what we mean is for every 2 degrees that this arm is moving up, we have 1 degree of outward and upward rotation of the point of the shoulder blade here. So this needs to move out and around so that this space right here will start to become more vertical so that we're not impinging the upper arm with the clavicle or the acromion process. This is what's referred to as impingement syndrome or shoulder impingement. Now, why would that be the case? Well, sometimes what we see is a restriction in the actual connective tissue itself, whether that is the actual posterior capsule of the shoulder here. Okay, that can be tight from previous injuries and or a lack of movement itself. Now, other areas that we want to refer to is actually the muscle systems itself. So what we're going to be looking at here is a number of different, I'm going to change this to just an upper limb model here, and we're going to be focusing on, right? That way we don't get all the other stuff here. So we have your rotator cuff here. So this is part of your, we have the supraspinatus, infraspinatus, teres minor. These are your traps. Now, when we add more layers, we're going to see some deeper layers. But the focus here that we want to look at is very commonly we have restrictions from the teres minor, teres major, minor major, and the lats that come through here and or the posterior capsule, restricting the amount of movement that we can get from the upper arm to here. Remember, as this comes up overhead, as we see in this model here for an overhead press, right? In order to facilitate this motion, we can't see this backside completely, but you can see this upper arm, this arm needs to move away from the shoulder blade, right? It's in this vertical position, that shoulder blade needs to sweep up and around in order to create enough space for the arm to get overhead. Okay, so in that we see very commonly a restriction here. So that's one area. Now, if we keep layering on here, that's obviously the arm there. We're going to see a number of muscles here between your upper traps, your middle traps, your lower traps, and the rhomboids that would be restricting the actual scapular region, right? So if we take these layers off, so we can see here we have paraspinals, which help keep us upright. We have part of our serratus posterior here. We have different parts of the levator scapula there. And then within here, we have our rhomboids. And then we layer on again, upper, middle, and lower trap. So all of these could be culprit to not allowing this shoulder blade to articulate and rotate out in the direction that we want. And in doing so, if this cannot rotate outwards, now this roof or this opening will not be directed towards a vertical position, preventing how much your arm can go up overhead. So this could then lead to issues down the road that would be potentially rotator cuff in nature, or impingement in here, in which typically you're going to find that you're going to be compressing that supraspinatus tendon in this space here, as well as the bicep tendon, which comes right through here as well. This gap is normal, and that gap will close down as you get overhead. So we want to ensure that we have the utmost amount of rotation between this shoulder blade moving away from the thoracic spine and that shoulder there. So those are a few of the problem areas that you would need to address or work on if you are having these range of motion deficits.